I'm Michelle Shear. I oversee our York Adams residential programs. So basically, I'm the director of our York Adams residential services. I've had the pleasure of being with the agency for well over 25 years. And interestingly enough, I started this position when I was in college. I started working at one of our group homes, fell deeply in love with the population and with the organization, eventually got my degree, moved on to work crisis intervention within our organization, and my heart always belonged to residential. So after that, I left the organization for less than a year, and then the director of residential services position came open, and I was asked if I would return just to interview for the position. At first I was a little leery because I was pretty young, but I interviewed, and like they say, the rest is history. I've been back with the organization since 1991, and since that time, our residential services were very small. We served 24 individuals, and now we serve over 100 individuals in York and Adams County, and we have well over 80 staff working in our residential programs. True North Wellness Services has several different residential programs available. So I'd like the opportunity to tell a little bit about each of them. Our oldest residential program actually started in the 80s, and it's called CRR. It's actually Community Residential Rehabilitation Services. Those services are licensed by OMSAS, the Office of Mental Health and Substance Abuse Services, and as I said, they've been in existence since the early 80s. We have 2 of those sites. Each of them are located here in Hanover, and each site serves 8 individuals. The individuals at those sites are typically coming from state hospitals or longer-term psychiatric units. So, in other words, everyone served in our residential programs has to have had a history of mental illness. And it has to be chronic, meaning that it's impacted their life on a daily basis. So, the 2 CRRs, as I said, are located in the Hanover area. Those programs are transitional. Average length of stay is about 13 months, and when an individual comes in, the goal is to teach them skills, daily living skills that they'll need to move out into the community. Things such as managing their medications, socializing, vocational skills, hygiene skills, those type of things. So, as I said, the goal is for them to move out into their own apartment. We have a program available called supported housing. So individuals leaving the CRRs will move into supported housing. They locate their own apartments, and they have a caseworker that works with them. It's not a 24/7 program as the CRRs are. All of the programs we have are 24/7 coverage for staff, except for supported housing. So a staff is always on duty. But with supported housing, they move into the community, and then the caseworker acts as a safety net, gives the individuals what they need as far as maybe need transportation to grocery stores, need assistance going to the doctor's office, those kind of things. That's a very low level of care for residential services. We also have a program called Assisted Living. We have 4 homes in the Adams County and York County areas that serve 3 individuals each. The individuals there also receive 24/7 care. Staff are on site with those individuals, preparing meals, helping with medication monitoring and such. The individuals at those sites are typically older. They have some medical issues, which can complicate their psychiatric issues at times. And that's our assisted living is probably the highest level of care that we do have, because the majority of individuals there will spend the majority of the remainder of their life at that site. It's not to be mistaken with a nursing home, because it's not licensed like a nursing home, but our staff do work with individuals that do have medical needs. Then our last service is our CHIP services. CHIP stands for Community Hospitalization Integration Project Program. We have several CHIP sites. We have a CHIP site available, or located, I should say, in Chambersburg. We also have some in Adams County and some in York County. Those services are designed or were designed for individuals leaving Harrisburg State Hospital. Harrisburg State Hospital began to push for deinstitutionalization back in the 1994, and with that closure came dollars into the community. Community dollars were used to acquire apartments for these individuals leaving the state hospital. And then they moved into the apartments. Staff are there 24/7, but the unique piece of this program is every consumer, every client has their own apartment that they're responsible for managing. Staff do in turn help with medication management, transportation, food prep, those kind of things. But again, that's more of a long-term program too, whereas the CRR is more transitional. As I shared, our residential services have been around for many, many, many years, and we've been very privileged to receive money from the county to run our services. But those dollars are actually capped, so very rarely do we receive increased funding from the county. The funding we receive this year will more than likely be the same that we received last year, the year before that, the year before that. So you can tell it's very difficult to fund or to keep these kind of programs running, because if you give staff raises, if there's inflation, groceries, utilities, all of those things go up, and the budget doesn't account for that. So that is our initial challenge, but our biggest challenge is with our services, we really strive to give every client an individual experience. And what we found over the years is we work very hard to take our clients on vacations, outings, trips, socialization activities, and those activities are very difficult to fund. So just for example, we do an annual trip to Ocean City at some of our CRRs. Those individuals going to the beach, many of them have never touched sand, many of them have never walked in the ocean, felt the sun like beating down on them. When they tell the stories, it just is remarkable, because fundraising dollars have helped us to allow our clients to do those kind of things, even if it's to go see a Christmas show or go shopping for the day, at a faraway place, everything like that. Those are enriching life experiences that everyone deserves to have. And the dollars that we receive do help us fund those type of things. In addition, the dollars we receive from the county don't help us to remodel, refurbish a lot of our sites. A lot of our sites are older too, and we've done a great job at keeping up with them, but that's usually through grant writing and trying to decrease staff funding in some areas and just really trying to work numbers. And the sites do need attention, just as your home would need attention. So the dollars that we receive can help us to upgrade, to paint, to renovate bathrooms, those kind of things. So they're greatly appreciated. One of the biggest challenges I've had to deal with within my career has certainly been the COVID-19 pandemic. I think that in a nutshell, the pandemic has brought so much strength that True North has to light. The amazing staff we have, the dedicated staff, people willing to go above and beyond and risk their own safety for the individuals we serve. On the other side, it's impacted our clients. Within our residential facilities, we've been in quarantine. The clients have been in quarantine since early March. We actually initiated it for their own safety prior to the governor's initiation. The clients on good days stay very active. We've implemented things within the sites, day programming, activities, but for those of our clients who have anxiety and depression and paranoia to begin with on a good day, what COVID has made all of us realize is things are unsure right now. This is a time of we don't know what's coming. And for the individuals that suffer from those type of feelings to begin with, this just compounds it. So our staff are very challenged to keep individuals calm, keep individuals willing to stay quarantined, not only coupled with the challenges of having 7 or 8 individuals with chronic mental illness living in one site. People get on each other's nerves. So the staff have been wonderful. We've had to implement all kinds of emergency procedures, the same as many businesses have. Temperature taking, wiping down areas, social distancing, things along those lines for sure. We have noticed some clients, like I said, that have struggled, have been hospitalized during this period. And that's a very scary thing too, because when they come back, then they, in essence, if they do have a positive COVID diagnosis, they could be impacting the rest of us. We've had to designate quarantine areas within our sites. A lot of emergency preparedness. Finding PPE equipment is impossible right now for us because it's all going to the hospitals. But we're dealing with those situations here. So it definitely has been a very humbling, anxiety-provoking time for all of us. But the staff have gotten us through. Our staff are our biggest commodity, and they are so willing to give everything that they have right now and always. So without them, we wouldn't be able to do this.